Today, we're going to be talking all about puberty, the latest, what we know, what we don't know, how to navigate puberty in a changing world. My name's Edith Bracho Sanchez. I am a primary care pediatrician here at Columbia. I also lead our external affairs team. I have an amazing group of experts with me this evening. And while we give everyone a couple of minutes to join the webinar, I just want to remind you and put a little plug in for our social media channels at Kids at Columbia. We are everywhere, essentially. We don't have a TikTok yet, but we're everywhere else, most recently on LinkedIn, where you can find really expert advice and tips from our pediatricians, learn about our programs, learn about upcoming webinars, really just so much going on. So we hope that you will take a second to give us a follow and stay in the know. We also have a newsletter that we put together every month. There's really so much good information in these newsletters. So really, again, just a plug to sign up for it. If you're not able to scan the QR code right now, we're going to send a link. Don't worry, in the webinar recap from this evening. With that, let's go ahead and introduce you to the amazing experts I have with me this evening. First, we have Dr. Warren Ng. He is a psychiatrist and the Director of Clinical Services in Child and Adolescent Psychiatry. We also have Dr. Dina Romo, who is an adolescent doctor, an adolescent specialist. She is the medical director for school-based health here at NYP Columbia. And we have Dr. Aviva Sopher, who is an amazing pediatric endocrinologist and who has lent us her expertise many times before. Let's get started. So because we're going to be talking, and I'm going to stop sharing my screen, because we're going to be talking about girls, boys, females, males, I do want to take a moment to acknowledge who we are talking about, what we're referring to this evening. So I'll go first to you, Dina, to give us working definitions of what we're going to be talking about this evening.
Sure. Thank you, Edith. Happy to be here. So I think this is a great topic. And like you said, we're going to be referring to boys, girls, females, males. And I think that it's important to acknowledge that, there is a difference between sex and gender. And for the conversation, we'll be referring to male and female more for the sex assigned at birth. So essentially, like when a baby's born and the doctor says it's a boy or it's a girl. And so in this conversation, when we refer to a boy or a male or a girl or female, we're referring to the cisgenders aspect of that. So that means that, the female is experiencing changes that a female body would experience, and also somebody that feels like a female. And the same for a male, somebody who's developing, the male body parts, and also feels like a male or a boy. That also, that's not to forget that children may experience gender in many different ways. And that's something that we might talk about later as well. But just for the purposes of getting the conversation going and kind of letting everyone know what we're talking about.
Yeah, it's such an important reminder that what we're talking about is really this, girls, boys as they were assigned at birth. So with that, let's transition to what our topic is this evening, which is really puberty, right? And I think all of us have a general understanding of what puberty is and what it can look like. But again, to be super clear about what we're referring to and the definitions, Aviva, I was hoping to go to you to give us a sense of what the ages are that is normal or considered normal for puberty to begin, and really what those signs are that puberty has started. Knowing again that we all have our own ideas, and most of us have gone through puberty, right? But what are the signs that tell you puberty has started, and when is it happening?
Absolutely. First of all, thank you so much for inviting me to participate in this. The official start of puberty is heralded by breast development in girls and testicular enlargement in boys. So it may be more obvious when a girl goes into puberty than when a boy does. This is, it's important to know that this is different than adrenarche, which is when the adrenal glands start secreting more hormones. And signs of adrenarche can be pubic hair, axillary hair, and axillary odor. Normally, timed puberty can start as early as age 8 in girls and as late as age 13, and as early as age 9 in boys and as late as age 14. The average age of onset of puberty is about 10 and a half years in girls and 11 and a half years in boys.
Yeah. So Aviva, I think you're sort of and this has been so helpful in the conversations that you and I have had for me as a general pediatrician to understand the difference between puberty, right? Like the big bad puberty or not bad, the big puberty starting to happen, right? And agenarche. And for me as a general pediatrician, understanding that agenarche is not always concerning or abnormal has been a big learning in recent years, to be honest. So how should general pediatricians think about this differently? And
Sure.
specifically, I'm talking about agenarche.
Sure. So, first of all, there's a difference between normally timed puberty and agenarche and early puberty and agenarche. So, there is a condition called premature or precocious agenarche, where you can see early onset of pubic hair or body odor in really young kids. And sometimes, and we're not actually sure what causes this. Sometimes it can be a sign of an underlying disorder, such as a non-classical congenital adrenal hyperplasia, which is a really long name, but it's an enzyme block in the adrenal glands, or it can just happen and we monitor it. Um, Puberty, so generally when puberty starts, breast development in girls and testicular development in boys is the first sign, and adrenarche generally follows. That occurs in about 90% of the population. However, in 10%, you can have the opposite, where even within the normal range of age, a boy or a girl can start with body odor or pubic hair or axillary hair before they show the official signs of puberty.
Yeah. And I'm going to ask you one more question and then I promise we're going to move on from this. This is just so fascinating for me as a general pediatrician. When do you worry about premature adrenarche itself? I feel like I have referred a lot of patients to your team,
Oh,
an amazing team of pediatric endocrinologists here at Columbia, just to put a plug in for you and your team.
thank
But
you.
I have sent, so many kiddos to you with this, hair and body odors. And I feel like you guys end up watching in addition to working up and doing an initial, workup, so to speak. So tell us a little bit more about when that is concerning.
So anytime it does occur below the ages that I mentioned, so 8 years old in a girl or 9 years old in a boy, there should be somewhat of a workup done. So
Yeah.
a basic evaluation would be an x-ray of the hand for the bone age to see if the bones have matured. Because if the bones have matured past the actual age of the patient, then it's a sign that the hormones have really been rampant in the body, and
Mm.
that's more concerning. If you do an x-ray of the hand and the bone age is appropriate for age or even behind for age, it may be less concerning. Also, it's really important to remember that, as I mentioned before, there can be underlying medical conditions that can cause this. So it's always worthwhile to communicate at least with the endocrinologist, and we can even guide you through the initial evaluation and give you feedback. But what I always tell my patients is that even if we give you like a clean bill of health the first time we see you and we say, it's just a physiologic thing, don't worry,
Yeah.
follow-up is always really important because even though it may seem like it's not progressing rapidly initially, it can change. So we like to continue to follow patients either with their general pediatrician or in the endocrinology clinic.
Yeah. Perfect. That is so helpful. And just a reminder for everyone who is joining us this evening that you can send us your questions through the Q&A. We may try to incorporate them as we're speaking. If not, we're also going to leave time towards the end to try to get as many of your questions answered as you have questions as we keep talking this evening. So I want to ask you next, Dina, talking about, the ages that puberty is happening these days and the wide range during which puberty can start and happen, right? In surveys conducted on healthcare providers, a really concerning amount of us are not comfortable talking about puberty. So when should we start in the general pediatrician's office talking about puberty with our patients, and what's the best way to do it?
Yeah, it's true. It's a tricky conversation to have, I think, not only for physicians, but parents as well. Even though it's such a natural process and we all go through it. So that's the most important thing to remember, right? We all go through it. And it's also important to acknowledge and notice when children start noticing body changes, right? And they start noticing body changes or differences between bodies at a very early age, not when they're about to go through puberty or while they're going through puberty. So it's really important to start those conversations early and, and how to do it. Well, being aware of your child or your patient, being aware of their questions or their curiosity and using those opportunities as teaching moments to talk about body parts, right? As they notice differences in parents' bodies, in their friends' bodies. And then just using correct terms, correct anatomical terms, so that so they get used to using those terms when referring to them and talking about them. And also just so that they see that you're comfortable having that conversation, right? And it may feel awkward, but I say whenever something feels awkward with kids and teenagers, just, roll with that resistance that you might be feeling and just go through it because it's such a crucial conversation to have. And it's also crucial that they feel that you're comfortable having that conversation because they're seeing it, whether you're having that conversation or not, they're seeing it, on TV, they're seeing it live, with their peers and relationships that they're noticing, and online too. So we want to make sure that either us as parents or as their medical provider that we are providing reliable information and that they feel comfortable coming to that. It's also, I would say, not a conversation that you sit down in a very planned way. Again, you kind of just, I would say, in an organic way as the topics come up, and they often do. If you're paying attention, they often do is start talking about them there, and they could be short conversations, but they're usually short and often and frequent.
Yeah.
So just keep your eyes and ears open to those opportunities because I think waiting for them to start going through it is already too late and they've already may have, received information from various different media or other sources. And again, you want to just be a reliable source of information.
Yeah. So I'm going to tell you about something I did when I was a brand new pediatrician. I know better than to do this now, right? And I've read more of the literature, and I know better than to do this now. But I think I may not be alone in meaning well, but not necessarily getting it right. So what I did was I had a young girl. She may have been like 8 or 9, and she was starting to show signs that puberty was starting, right? And I sort of sat her down and I was like, okay, here's what's going to happen. And what I thought was a, developmentally appropriate language, I outlined what was going to happen in terms of body changes. And then I got into the conversation about menstruation all at the same time. And she looked at me like I had 3 heads, and I just completely overwhelmed her.
Yeah.
So how do you break this down, Dina, in like practical ways so that it's digestible for the kiddos that are coming to see us, and it's digestible for families at home who feel like they want to get started but don't want to overwhelm their kids.
Sure. I think one, keeping the age in mind. So as Aviva mentioned, keeping that lower age in mind, 8 and 9 for girls and boys. So it may be as early as 6 or 7, even before that. But again, just starting to use anatomically correct terms. Just say, if, for example, I'll use my own example with my own child, who asked questions about different body parts. And I said, yes, when you're older, you will develop such and such, and this is it. And again, it doesn't need to be a full-on conversation of the whole process, but just little bite-sized pieces. If they happen to notice or hear a friend talking about menstruation, again, normalizing it, being calm in that conversation. This is something that all females go through, and it's okay and normal. And then little by little, again, your child or your patient when they're ready, and take a pause. Sometimes we want to like give all of the information at once, but I think it's important to also just take a pause and wait for questions, because they will have questions. And then, give them those bite-sized pieces of information about, what does it mean to wear, a sanitary napkin or a pad? What does it mean? What is a tampon? Like what all these terms are.
Yeah.
Yeah.
Yeah, I love it. And educating our boys also on what tampons and pads are. Every time I
Yeah.
have these conversations, I'm like, let's not forget the boys when we're having conversations about menstruation and, what different items that you may see in the classroom now are, right? Because I think it reduces stigma, right, for girls as they start to go through these things. Um,
Absolutely. And vice versa. I think it helps, to again have inclusive conversation for both boys and girls in a bi-directional way, so that boys can empathize with the girls and the girls can empathize with the boys. And, they understand that everyone's going to go through these changes at their own pace. And again, just takes away from some of that stigma or that awkwardness that it's different, but it's really not. We all go through it.
yeah, totally. Healthy part of growing up. Um, Lauren, it does feel like the background of puberty is different these days than when all of us here on the call this evening went through puberty. I think it's, of course, the specifics, right, of the order of events and what's happening to the body has not changed. Biology has not changed, but I do think the context is a little bit different. So my question to you is, how different is it? What's making it different? And what can we do?
Sure. Thanks so much, Edith. And thanks for inviting me to this wonderful panel with Dina and Aviva. So I think first I would invite everyone to just remember their own puberty. Let's just go there because I think when we're able to center kind of what it was like for us, exciting, awkward, kind of crazy, that's okay. Part of it is just to acknowledge that your young person or the young person sitting in front of you is going through their own journey and process, and trying to just be empathic. And sometimes we do that by being able to put ourselves in the other person's shoes, even though ours might be quite different. So I just invite everyone to just go to that awkward adolescent space, and just to remember what that was like. But Edith, like you're saying, things have changed, and the backdrop in which puberty is occurring for young people these days is dramatically different. And I'll just point out some of those differences, not all of them, but some of them. And as a child and adolescent psychiatrist, I definitely have to point out to the fact that we've seen actually a couple of decades of worsening children and youth mental health issues. And I think it really culminated during the pandemic. which made things so much worse for everyone, particularly for our young people, between isolation, fear, anxiety, loss, as well as really the disconnectedness that people felt. Um, we kind of emerged out of the pandemic with a youth mental health crisis. So the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association declared a national emergency. And since that time, also our Surgeon General, Dr. Vivek Murthy, has also put out advisories on protecting youth mental health. So we're acknowledging that what is different in terms of our backdrop is really the fact that young people are having a harder time than ever. And so on top of all of those things, put on puberty. And so I just think that we have to appreciate the backdrop. And if this was a drama, that's your stage. And there's a lot of melodrama going on in puberty and adolescence to begin with. But just a couple of numbers, just to highlight just our reality, is that 1 in 5 young people are currently experiencing a mental health condition. Less than half of them receive care. And usually there's a delay between onset of symptoms and receiving care of about 8 years. And so that's a whole childhood. Suicide is the second leading cause of death for young people 10 to 14, and the third leading cause of death for young people 14 to 24. But when 50% of all adult mental health conditions start before the age of 14 and 75% before the age of 24, we're talking about young people going through quite a bit all at the same time. So I think that when we think about that backdrop, I think we just want to appreciate sort of the context. So now that we may be talking about puberty, but we're also having to acknowledge that with all of the hormonal changes, as well as the social, emotional, psychological, and biological changes, sometimes we have to tease apart whether or not we're also experiencing depression or anxiety or something else. And I would just say that the other thing that has really changed, I know that when I was growing up, and I'm actually rather grateful that I didn't actually have social media in my presence, because I think that there's just a new level of being a young person that our young people have to face, and just appreciating that social media is not an all good or bad, but it definitely has its issues when we're talking about young people who are navigating sometimes their turbulent puberty, adolescence, and trying to figure out who they are in this world and what they are like compared to their peers.
Yeah, which are all normal parts of adolescence, right? Like they really are trying to figure out who they are, how they compare, and find. And it's definitely hard to do it when you're always performing on social media and not able to take a break. I do want to ask you one follow-up question, and then I think there's also a couple questions that are coming in the Q&A. One for parents at home who are sort of thinking, is this puberty or is this depression, anxiety, or another mental health condition? What are some general guidelines that they can sort of go by, knowing, of course, that we as your pediatricians are always here to help, but what are some general guidelines to help sort that out?
Thanks, Edith. And you really named it. I think if you have questions, going to your trusted pediatrician, your physician expert in development and young person, always they're in your corner. But I think one of the things that I would say is if you're not certain, just be open to learning and understanding what it might be. It might be puberty and depression. It might be anxiety and stress. It might be a lot of different things, but part of what your role is trying to understand the situation better. I always encourage parents, particularly with adolescents, is that it's so important to have a conversation and have a dialogue. And the most important part of that dialogue for parents and as well as pediatricians and anyone taking care of young people is actually to listen. Because sometimes we're really good at talking, but I think we could really practice the art of listening, because when we listen, we kind of hear what the young person is experiencing instead of projecting onto them, hey, I think this is puberty. Hey, I think this is depression. And it's really important to just listen and really be open to learning about what our young people are going through. Of course, one of the things as a child and adolescent psychiatrist, one of the things I'm very most concerned about when we think about how do we differentiate between what is having a bad day, what is feeling sad, versus what is depression. And there are diagnostic criteria for having a major depression. And I think it's really important to talk to your pediatrician, but also if you have a child mental health expert or professional, that would be another concern. But you're really seeing changes in level of functioning. So we're not talking about sort of a momentary lapse in kind of how they're doing and how they're feeling, but really having trouble sleeping for up to 2 weeks at a time, changes in appetite, behaviors, sad or helpless mood. And one of the things that I'm very mindful of is that CDC does a youth risk behavior survey, and that's to 17,000 high schoolers, 9 to 12 years old in grades. And they found that 44% of adolescents felt persistently hopeless and sad. And 2/3 of adolescent girls felt that way. So what we're saying is that when we're looking at some of the concerns related to, is my young person or the young person I'm talking to depressed at this time, it's always good to really keep that question in mind. Go to your pediatrician, get a PHQ 9 modified for teens or PHQ adolescent. Ask some of those key questions to understand what's going on. And I'd shared earlier on that suicide is the second leading cause of death for young people, and also increasingly younger kids, as particularly affecting youth of color as well as sexual gender minority youth, especially when those two go together in intersectionality. So just being mindful that you do want to listen, and it's important to be able to create that space to have that dialogue.
Yeah, there's so many nuggets of information in what you just gave us, Warren. But really, I think at the end of the day, it's exactly that, the listening, right? And the being curious about what our teens are going through and in taking seriously what their problems are. I can't tell you the number of parents I've taken care of a number of parents who are on a range of positions on this, but there's parents who take their kids' concerns very, very seriously, and bring them up to us right away. And then there's parents who perhaps wait a little bit longer, and attribute symptoms to puberty. So perhaps finding the right balance and listening to your gut as a parent as well, when something just seems like it's going beyond and your child has persistent symptoms like the ones that you have described, Warren. I do want to transition back to you, Aviva, talking a little bit about the early puberty that is happening more frequently these days. Knowing again as background all of the things that we talked about, puberty being different, the background of puberty being a little bit different these days, because I do want to understand, and would love for you to help us understand how early puberty is happening these days and why it's happening earlier than it used to, which I know is $1 million question.
Sure. So I want to first just give a little background. Precocious puberty or early puberty is 10 times more common in girls than in boys. So we're going to see this happening much more in girls than in boys. However, it's really important to note also that 90% of girls who have early puberty do not have an identifiable cause, whereas 50% of boys who have early puberty do have a cause. So when a boy does present with precocious puberty, even if they're close in age to the cutoff, it's really important to do a detailed evaluation to make sure there's nothing underlying that's causing this. I also wanted to mention that puberty starts in the hypothalamus and pituitary glands in the brain. So anything that affects brain chemistry theoretically can affect puberty and the onset of puberty. So the onset of puberty is triggered by a cascade of events. The hypothalamus releases a hormone called kisspeptin, which then stimulates what we call a GnRH pulse generator. And that starts releasing little pulses of GnRH, which is a hormone that signals to the pituitary gland to release luteinizing hormone, or LH, and follicle stimulating hormone, or FSH. And those are the hormones that in girls go to the ovaries and signal to the ovaries to start, like I always say, like waking up, and to the boys, to the testes, and same thing, so that the ovaries then start producing the estradiol, or a form of estrogen, and the testes start to produce the testosterone. And that's when we start seeing the characteristics of puberty, once the organs, the testes and the ovaries start producing their respective hormones. Now, regarding the onset of puberty, there have been many recent studies that have shown us that puberty is happening earlier. So, for example, a major study that looked at kids between the ages of 1977 and 2013 noted that the mean age of puberty has declined about 3 months per decade between those years. So, over 40 years, it's declined 3 months per decade. So that's about a year earlier in that time period. A Danish study showed that voice deepening, that's kind of like a hallmark in boys that we see, occurred on average at age 15 in 1968 and has now decreased to 13. The mean age of menarche, or the onset of getting one's period, in Europe and North America declined from 16 to 17 years in the early 1800s to 13 years by the late 1900s. And that was attributed to improved nutrition and socioeconomic conditions. A recent study shows that there has been a 15-fold increase in early puberty in boys and a 6-fold increase in early puberty in girls between the years of 1998 and 2017. And most recently, there was the Apple Women's Health Study that was launched in 2019, and that showed among 71,341 females, the average first period decreased from 12.5 years between the years of 1950 and 1969 to 11.9 years between the years of 2000 and 2005. And also really important, in the same time period, the percentage of girls who experienced early menarche before age 11 increased from 8.6 to 15.5%. And those that had very early menarche, which is defined as menarche before age 9, more than doubled from 0.6% to 1.4%.
Aviva, why is this happening? I mean, the numbers are striking, and
Absolutely.
it is, you know, concerning to all of us as pediatricians and as parents. Why is this happening? What do we know?
So first of all, again, it's really important to note that all this really comes from the brain, from the hypothalamus and pituitary. So we can think about things that may affect the brain chemistry. One of the important things to note is that stress, many different kinds of stress, are associated with earlier puberty. And first of all, the hormone noradrenaline, which is a stress hormone that comes from the adrenal gland, stimulates the luteinizing hormone secretion. Additionally, the effects of cortisol, another hormone that comes from the adrenal gland and is known as a stress hormone, may lead to earlier puberty. In recent history, during the COVID pandemic, there were many reports of earlier puberty, and this is thought to be possibly related to stress, as Warren was talking about before, the social isolation and some of the other things that the kids were experiencing. Interestingly, even anxiety may be associated with earlier puberty, natural disasters, assault, sexual abuse, domestic and urban violence, and even having an unsupportive family. So all of those and many more are stressors that have been associated with earlier pregnancy. I'm sorry, earlier puberty.
Yeah.
Another really important thing to note is that obesity is associated with earlier puberty in girls, but maybe later puberty in boys. So that one we don't totally understand, the sexual dimorphism in this. It's possible, at least in girls, that the hormones such as leptin and ghrelin may explain the link between obesity and earlier puberty. It's important to note that there is a certain amount of body fat required for menarche to happen in girls. So possibly having even an excess amount can trigger earlier puberty. And then, of course, are the endocrine disrupting chemicals, which, have become very newsworthy most recently. It's important to note that there are chemicals in our environment that are used in a wide variety of items that we commonly use, may have either estrogenic, androgenic, anti-estrogenic, or anti-androgenic activities. So there's a whole host of different effects that these chemicals can have. The most common are the phthalates, the parabens, and the phenols. And for example, phthalates can be found in nail polishes, hairspray, hair mousse, skin lotion. Parabens can be found in cosmetics and fragrance, and phenols can be found in antibacterial soaps. So these chemicals are ubiquitous, and there's been a lot of research looking into what sorts of effects they do have on earlier puberty.
So what I'm getting from all of this, Aviva, is we try to reduce and manage stress as best we can, knowing that there's no such thing as being able to protect our kids from all stress and all adversity. We try to maintain healthy lifestyles and weights, minimizing the processed foods and, intake of high sugars and things like that. And then we try to buy products that don't contain those three chemicals. Say them one
Correct.
more time, Aviva.
So there's the phthalates, so it's spelled PHTHALATES,
Yeah.
the parabens, and the phenols. So it's like the three Ps.
Yeah. Okay. All right. And then plastic in general, Aviva. I'm going through this process. I do it periodically where I just sort of throw out all plastic in my household. I sort of like look back and I'm like, what else have we accumulated that's plastic? And I cleanse the house of plastic. How much do we need to be freaking out about plastic?
So I'm definitely not an expert on plastic. I know that many plastics do have markings on whether or not they do have the plasticizers that can be endocrine disrupting chemicals. So it's important to know which plastics you're using. Look for the symbols that can mark whether or not they have them or not. I think that's where I would start.
That's really helpful. Now, Dina, I do want to transition to you because we're talking about all this, puberty happening earlier and reasons why it may be happening, which are very clearly multifactorial. But on the ground, what does it mean in our schools? What are the ramifications of girls and boys developing earlier?
Yeah, that's a really interesting question. So it affects everybody in the schools, really. So to go through them all and briefly, for youth principally, there can be several ramifications. Because if you think about it, everyone goes through puberty at their own pace, right? There, like Aviva mentioned, a wide range for both boys and girls, but the grade that the child is in or the adolescent is in is fixed, and usually by an age cutoff, right? So their peers may be going through stages of puberty at various different paces, and that not only includes their body changes, so what's obvious to them, right? And some may experience it earlier than others, some may be late bloomers. But all of that creates this environment where there's differences. Whereas up until this point, kids, for the most part, were going through milestones in a very similar pace and fashion, right? So, so this can be a little stressful, for youth to navigate in that setting. So they can unfortunately experience some teasing, and it can turn into bullying, in-person bullying, cyber bullying, Yeah, I like Warren's comment about not having had that that media when I was going through it myself. But we, as you know, as Warren mentioned, if we all think about our puberty, we certainly, I'm sure, have memories about, you know, the awkwardness of that time and how we felt amongst our peers. So keeping that in mind and understanding both for parents and teachers, you know, and if your child's school has a school-based health center, that children and adolescents might not be so forthcoming about how they feel and if they're being bullied or if the reason that they're feeling down is because of the bodily changes and the emotional changes that they're going through. So it's important to check in. And again, that starts with early conversations and feeling comfortable with those conversations, whether it's at home or whether it's with your primary care provider, your pediatrician or adolescent medicine specialist, or in your school-based health setting. You know, to have those conversations where they feel like they have a safe space to talk about their developing bodies. Um, you know, for parents, medical providers, and schools, I would say to, as we mentioned earlier, start preparing early and in anticipation of those changes. It's good to know in schools what are the health education topics that are covered because it might not be standard for all schools across all states and even cities. And some schools do better jobs and more comprehensive job than others. So checking in with your school administration, your teachers to see what, you know, what their curriculum covers. And sometimes you may need to fill in the gaps, you know, as a parent or as their primary care provider. Those are opportunities to have conversations to see, okay, that, you know, they're missing some part, or sometimes even to unteach some things that they may have learned, you know, through unreliable sources,
Yeah.
with their peers, or, you know, or even misconceptions that they learned at school. Um, you know, the other thing I would say is that to the school setting, while it can feel like, oh my God, all of these changes are happening and it can feel very scary, it can also be a very supportive environment for students in many ways, not only in their classroom, but also, you know, if they do have, most schools have mental health providers. So making sure and being aware of what those resources are for students and children during this phase. But in the school-based health setting, which is, you know, my area, what I would say is that areas in, if your child or patient does have a school-based health center associated with their school, is relying on their support for many different things. So, you know, if there are questions about body parts, I think a lot of the questions I get from young adolescents, right? And by that point, it's already like they've experienced so much already as part of their body changes. Is my body normal? A lot of the questions are, is this normal? And there's a variety of normal. So I think that, you know, being that space where we can provide a safe space for an exam, it is, you know, it is great. And if not in school, then with their primary care provider. It's also a time to, you know, talk, right? These are like natural conversations that come up as part of your medical visit, or, you know, in the school health setting, right? You mentioned menstruation before, is making sure that kids are just having what they need practically to get through these moments, right? To have menstrual products available at their school sites, in their bathrooms, places that they can access things in a non-judgmental, non-stigmatizing way, again, because everybody's not experiencing, you know, the norms of going through a monthly cycle. You know, so talking to your school administration, to your teachers, getting involved with the PTA, and advocating for, you know, for some of these changes to happen if they haven't already happened in schools, you know, to start supporting at a young age. Again, you know, even you know, when kids are before junior high, I would say, because girls can start menstruating as early as elementary school.
Yeah. So I think you just answered, Dina, a question that came in from Dr. Cristina Fernandez about really how to advocate, right? So with the increasingly younger ages of menarche for girls, how can we advocate as parents and pediatricians for school facilities, resources, bathroom privileges to accommodate these changes, as well as ensuring that third and fourth grade teachers are better prepared? What can we do? I can't tell you the number of letters I write for the school to let the kids go to the bathroom, which to me seems insane. Like, why am I writing this? What can we do, Dina? Is there anything else that we can do to advocate for this?
I think, not just like going personally or, coming together as group of parents to school administration about this. It's not something I feel like, looking back many years ago, this wasn't a topic of conversation. It wasn't even a thing, right? What we call like period justice or menstruation justice, right? Is having this equitable access to these products. So now, thankfully, it's more of a conversation that is ongoing and that there is recognition, both like in the legal arena and justice arenas, about providing these things as equitable, as equitable access to, products that are just naturally going to be needed. So I think that parents can feel a little bit more comfortable bringing up that conversation with their schools now, and and just being persistent about it. I think will make a difference. I certainly have seen amongst our schools that change happen, compared to several years ago when pads and tampons and menstrual products all had to be either, you had, if they were even present at all, you had to purchase them, which is definitely an equity issue. So again, just being persistent and advocating for this, I think is more of common ground and common knowledge, and will get attention and support and buy-in.
Yeah, totally. Warren, and I do also want to ask you in terms of mental health ramifications, right? So we're sort of talking about, what it looks like in the school setting and how to advocate for some of the practicalities. But in terms of the mental health ramifications, like what do you see? Are we talking about higher rates of bullying in kids that are developing earlier? Are we talking about other mental health conditions? What do you see and what's known about this?
Thanks so much, Edith. And the question you asked me before, like when parents are seeing their young people, what is it? Is this puberty? Is it depression? What is it? And I think that, and I think Aviva and Dina really spelled it out beautifully, like what's happening with their bodies and also what's happening in the world around them, in their schools and everything. And I think one of the things that we've seen, particularly in the research, is that when girls and boys go through puberty earlier, like as Aviva mentioned, precocious puberty, one of the things that we do see are increased rates of mental health concerns. And some of those concerns include anxiety, depression, non-suicidal self-injurious behaviors, often body image issues, which can then also lead to eating disorder behaviors or substance use behaviors. So, but I want to stop there because I don't want to scare anyone, because in a way, as we're hearing, more young people are going through puberty earlier, and oh my goodness, is this going to happen to all of them? The answer is no. But I think one of the things that we know is that there's just additional stressors that happen to young people when they go through puberty earlier. And as we mentioned, and you heard from Viva, their body's changing. And often what we see is that with girls, if they start developing their sort of their body in terms of their breasts or their physical appearance, one of the things that young girls often experience is that they're experienced as being older than what they are. And there's this, what they call the adultification bias. And then what happens is that, say, these young people, and their cognitive, emotional, and social development hasn't caught up with what their body is looking like to other people. And they may experience more sexualized behaviors or more provocative or really seen in a different light when they're still much younger inside. And so that's when your inside and outside don't match. And with that, I'm going to actually make a plug for if you want to have a conversation, which is what we're all talking about, like let's have a conversation with our young people. There is that Pixar movie, Inside Out 2. And I don't want to like plug a particular theme, but hey, whatever media works for you, use it as a conversation starter. But as you notice, actually, in Inside Out 2, Riley, who's the young adolescent girl in the story, when she was in childhood, she had her 5 feelings of joy, sadness, disgust, fear, and anger. And then when she becomes a teenager, it's anxiety, envy, embarrassment, and ennui. Now, those are not the actual moods that most people go through, but hey, it's a Disney film, so you're going to get all these other additional characters. But all I'm saying is that your young person might be experiencing all these different characters inside of themselves, and part of it is trying to make sense of it. It often does mean that when boys and girls go through puberty earlier, they do experience additional stressors. And I mentioned what happened to girls. What happens to boys is actually a little bit advantageous initially because they're then usually bigger than the other boys, and then often size can be helpful. But unfortunately, with testosterone also comes some aggressivity or impulsivity. So then you get that in the mix. And often if boys experience puberty earlier, it may also affect their growth potential, their height overall. So sometimes they have that experience of, hey, I used to be the biggest kid, and now, hey, why am I the smallest kid when they go through later adolescence? And so there are just different issues that that young people can experience, boys and girls, and just be mindful of the conversation and the dialogue. And I really want to plug like positive coping strategies because how we get through anything is really with each other. So the social support, as well as cognitive, as well as coping strategies that hopefully parents can practice and also work with their kids to also integrate mindfulness, proper sleep, nutrition, exercise, like all of those things that we know are good for kids, so that we can actually add that to the mix.
Yeah, and thank you so much, Warren, for reminding us and grounding us that most kids will not experience puberty early, but they will experience puberty. So all of the strategies that you are giving us and the things to look out for and to advocate for in school, Dina, and to look out in terms of their changes in their bodies, Aviva, are so important regardless of when they enter puberty, right? And knowing that most of our kiddos will not enter puberty early. Now, I want to go to a few of the questions that have come in. I think we've answered some of them. Let's try to answer as many as we can of the rest of the questions that have come in. So let's do a little bit of a rapid fire of questions. And absolutely agree, Warren, on Inside Out 2. Brilliant. And just a fun conversation starter to go watch with your teens if you haven't. So Aviva, the first question is for you. Do you think that we will be redefining the age of puberty anytime soon?
So one thing I didn't mention is that we have this like kind of gray area with both boys and girls. So that gray area in girls is between the ages of 7 and 8, where sometimes if they go into puberty at that age, we might not go into this mega workup because they're so close to the actual cutoff, especially if there's a family history with earlier puberty. On the other hand, starting puberty at a really young age can indicate an underlying issue. So at this point, I don't foresee changing the cutoffs, but I do see some wiggle room in making the definition.
Yeah. And another question for you, Aviva, is there, or how do you explain circadian rhythm changes that happen with the onset of puberty or right before the onset of puberty? Is that a thing that's known in the scientific literature? How should we think about that?
So I'm not sure why that does happen, but I think Warren and Dina, I'm sure, have had experience with this in their practices, but there's always been this push that adolescents need to sleep later, and some school districts have even, started opening school later to accommodate this change. I don't have an answer as to why that happens, though.
Yeah, but it happens and we should be advocating for it, it sounds like. Warren, for you, how do you answer questions about puberty when maybe the parent isn't ready for their child to learn about puberty? I think we all have this instinct to sort of protect our kids. They're too little, they're too young. Don't tell them about this, don't tell them about that. What if you have a parent who's still in that stage? How do you address puberty and answer questions?
Great question. I usually say, do you want them to hear it from you first, or do you want them to hear it from their friends or on TikTok, or like, how would you like it? And so it's not a question of if, it's really when. And so I say, do you want to be a part of that story? We talk about the birds and the bees, like, hey, have you had that conversation? Well, kids are exposed to so much media these days, and to also to each other. That's usually where they get their information, and not all of it is correct. And so I often say to parents, hey, do you want to be a part of having your kid learn what's most important from you? And we can use the developmentally appropriate language, and we can talk about what works for you. It doesn't mean that we're going to be pushing anything before it's time, but at the same time, we want to set the stage so that they can build that knowledge. Puberty doesn't happen overnight, nor does the conversation. So it's just being able to build that conversation over time, as Dina had mentioned it, like it's multiple discussions. And so you just want to set the stage, and you want to also just answer some of the fears and the anxieties that parents might have. Like, what are you scared of? What are you worried about? And maybe if we understand those concerns better, we're able to then frame the dialogue in a way that meets both the parents' needs as well as to help the kids. And also, as Dina said, some of these kids are probably getting it in their health class in the school anyways. So it's just being aware of all of those things.
Yeah, and empowering, right? I love what I love about what you just mentioned is really that empowerment. Like, do you want to be a part of this, right? And what parent's going to say, no, I don't want to be a part of this. Um, there was another question that came in, Aviva, that I think this patient's experiencing normal puberty, but let's see what you think. If the question is this, if menarche occurs early at 10 or 10 and a half, with thelarche, meaning the development of breasts happening in the right interval beforehand, and the patient never got a workup, would you recommend the same workup as for premature thelarche? Is that a patient that needs a workup? How do you think about that?
So we generally say that from the start of puberty, menarche comes about 2 to 3 years later.
Yeah.
So working backwards, if menarche occurred at 10 and a half, theoretically puberty could have started at 7 and a half, which would be considered early. So again, as I mentioned in girls, like between 7 and 8 is a little bit of a gray area. So if the child is doing great, if there's a family history of maybe an earlier puberty, we might not do the full workup. We might look at just a few things. But if there's any red flags, like the whole family went through puberty, at 12 and this child started at 7 and a half, or if there was a rapid onset based on parental description of what happened, we a lot of times do a workup. So it's really case by case.
Yeah. So interesting. But I don't think as a general pediatrician, I normally think about it in that way, right? If menarche happened at 10 and a half, and I'm thinking 3 years before, then maybe that child did fall in the early puberty and does need a conversation with
Mhm.
your friendly endocrinologist. That's a very interesting way to think about that. And maybe the answer's perhaps.
Yes. Yes.
Perhaps. Okay. Let's end. We've had a lot of very scientific discussions, a lot of positive discussions as well. I would love to end on a light note. I do think, as daunting as puberty is for some of us, there is a little bit of humor as well to some of the things that happen and can happen. So I want to go around and just ask you all very quickly, because we don't have that much time. What is your favorite myth about puberty and what's the reality? Let's start with you, Dina. You're muted.
Oh, sorry. I was gonna say there's so many, but I'll pick one in the interest of time. So I often hear from parents and my female patients, that when they have their period, they cannot swim, they cannot do their usual activities. Um, and to that I say, no, absolutely not. Like the total opposite. If anything, I would encourage activity, because physical activity has been shown to decrease menstrual cramps, improve mood, which can, change a little bit throughout the cycle. So I encourage it, and also just supporting that by letting them know of all the different menstrual products that exist nowadays that make it so much easier. There's period panties, there's period bathing suits, there's menstrual cups, everything is made for sizes of, for various different sizes and body shapes. So I always encourage it.
Love it. Warren, let's go to you.
Sure. I think since we're talking about the conversation, I would say that puberty or adolescence, one of the myths is that the teenagers don't need us anymore, because they're like rejecting us, they're opposing us, they're defying us. The important thing to know, I think, for parents or even as adults, pediatrician or adolescent medicine folks, is that sometimes that push and that pull is just the developmental part of the process. They still need us. They just need us in a different way. So what we need to do is we need to evolve with them. And so we need to change how we can be with them so that they can continue getting what they need from us, because they still have a lot of those things. So just to understand the world of the teenager.
Yeah, I love that. Aviva, let's go to you.
Okay, sure. So a lot of times, when a child starts showing signs of puberty, the parents become very concerned because they think their child's about to be finished growing. And they associate the onset of puberty with the end of growth, whereas it's really, you can go through all the stages of puberty and you're still going to grow after that. So it's really important to remember that the onset of puberty is the onset, and actually kids will start growing a lot faster once their bodies are exposed to the hormones of puberty, but they do have a lot of time to grow after as well.
Love it. And now I'm really glad that I asked you all that question. Thank you so much, Dr. Dina Romo, Dr. Warren Ng, Dr. Aviva Sopher, for joining us this evening. And thank you to all of you who watched at home or on your commutes. We will be sending out a recording of this webinar, and we hope that you will join us back in September for our next webinar, and you follow us on all the social media channels. Thank you all so much. Have a good evening.